It has happened again. At least 18 people have been massacred in yet another American mass shooting. This time, a gunman opened fire with an AR-style weapon in a bar and a bowling alley in Lewiston, Maine, before taking off, sending authorities on a manhunt, and putting the city and the surrounding area in lockdown. At the time of this taping, police and other law enforcement agencies are still looking for the shooter. And people in and around Lewiston are just beginning to grapple with what just happened in their community. I'm joined now by someone who knows the realities of mass shootings like these all too well. Dr. Hannah Sachs is a physician and the co-director of Mass General Hospital's Center for Gun Violence Prevention. I'm also joined by David Hemenway, a professor of health policy at the Harvard Chan School of Public Health. Hannah, David, thank you for being with us today.
Thank you for asking us.
This is a tragedy that we experience all too often in this country, just over and over again. And not to be flip, but it's possible that no one captured the helplessness we all feel better than The Onion, which runs a headline after every single one of these massacres. Onion headline, "No way to prevent this, says only nation where this regularly happens."
And that's true. It's so sad that every other country, and particularly every other high-income country, does so much better than we do about guns and gun violence. So I teach at the Chan School of Public Health, and there's so many international students, and they just cannot understand how we as adults let this happen over and over, particularly to our children.
Hannah?
Yeah, I mean, I think that says it so well. It's just so tragic that we're here again together to talk about the aftermath and talk about what we know comes next.
So David, you said that we're the only country where this happens. I think it's worth putting some numbers behind that. So, gun homicides per 100,000 people around the world in 2019. The Institute for Health Metrics and Evaluation Small Arms Survey. The United States is 4.12. So 4.1 Americans out of every 100,000 are killed by guns every year in 2019. In Israel, it's 1.05. In Canada, it's 0.5. In Australia, it's 0.18. Norway, 0.07. The UK, 0.04. And Japan, 0.02. So let's put that in perspective. That means that the gun homicide rate in the United Kingdom is 1/1,000th that in the United States. In Japan, it's 1/2,000th that of the United States. So what is it that they're doing right that we are doing so wrong?
It doesn't seem to be anything to do with violent video games. It doesn't seem to have anything to do with mental health. It has to do with guns. We make guns readily available. And remember, we're only talking about high-income countries here now. There are other countries which do worse, which are at civil war and so forth, and don't have police forces that are very good. But in terms of all the other high-income countries, we have by far the most guns, and particularly we have handguns, and we also have military weapons, and we have by far the weakest gun laws. So we let virtually anybody get any kind of gun they want very easily. And it means that, not surprisingly, we get lots of problems with guns. And if you want to, one of the things is to recognize is that if we learn from other countries, we don't just, it's not just one country we could learn from. If we just picked any other of the 30-plus other high-income countries and did what they were doing about guns, we would be much better off.
And as stark as those numbers are when you share them, as stark as those numbers are, when you just look at deaths, which is how we count the toll of gun violence in this country, that's a drastic underestimate of the full impact that we experience. When you think of what happened yesterday in Lewiston, we're gonna remember this shooting tragically by the number of people who died, but the number of people who are affected, whose lives were changed yesterday, the number of people that are family members of those that are physically injured or will have or will experience this trauma and emotional distress and other things that impact it. Every single person injured or killed by a gun has many family members and friends and colleagues and other people that are affected. And when you start to think about the toll of gun violence in that way, it really shows that those numbers you just shared, they're stark and they're a drastic underestimate of the impact of gun violence in communities across this country.
As Hannah was saying, gun violence, the trauma from gun violence leads to a really increased risk for all sorts of problems in terms of mental health, in terms of physical health through your whole life.
So let's put you're both experts on public health, so help me put this in perspective. In terms of threats to public health in the United States, where does gun violence rank?
If you're just looking at deaths, it's not nearly the highest in terms of deaths. It's heart disease, which kills most people, but it's mostly old people. Cancer kills a lot of people, mostly old people. What gun violence does is not only, though, kill people, and it kills lots of young people, but as Hannah was saying, it's more than just somebody falling down and getting a hip fracture and dying, which is terrible. But gun violence can affect the entire community. Gun violence in a lot of cities in the United States really affects the whole community. It means that it's really hard for the community to thrive and to grow. People are afraid to go out. Companies are afraid to come in. It has really devastating effects. So just looking at, this is only killing whatever it is, 40,000 people a year or something, that's really not the best or the only way to look at this. And it's clearly so preventable because, again, you can look at any other high-income country and they've prevented it in some way, and they haven't prevented it because they have fewer people with mental health problems or fewer people who get angry, or fewer people who get drunk, or fewer people who have beat their spouses. It's all seems to have to do with firearms and the way we treat firearms in the United States.
So I want to focus in on that a little bit, because it seems to me that the counter arguments that are always proposed, that this is not about guns, in a real sense, they would say something much worse about the United States, right? So, like, if it's about mental illness, that means that to believe that, you would have to believe that the United States is the only developed country where people have psychiatric problems. That would say something pretty awful about this country, right?
It certainly would.
So, if the story is that this is about gun violence and the magnitude is, I said 40,000, and I just want to build on that a little bit, because the United States is about to drop out of the top 50 in life expectancy among countries, which.
Right.
A statistic that it is hard to imagine that the wealthiest country in human history would be not in the top 50. How much of that is because gun violence by killing the young disproportionately lowers?
That's one of there's lots of reasons for that. We don't have a very good safety net in the United States. The United States is different from other countries a lot in terms of policies. It's hard to say we're that different in terms of people, because so many people from the whole rest of the world came to the United States. We are an immigrant country. So it's not like, oh my goodness, we're that different. But we are really different in terms of the way we treat people who have issues, who have been unlucky in life. And we don't help them as much as one might hope.
Hannah, there's a lot of variation in gun laws in this country, and there's a lot of variation in gun crime in this country. Can you help us understand what the relationship between those two might tell us about gun laws and what works?
Yeah, absolutely. And, as a clinician, sometimes I think about it a little bit differently. Of course, as David's saying, we have an opportunity to look at what works by looking at what other countries are doing, what certain states here are doing. But even states that have the strictest gun laws, we live and work in Massachusetts, a state that has the strictest gun laws in the country, among the strictest gun laws in the country. And still, in communities right here in Boston, if you're in Dorchester, in Roxbury, in Mattapan, when I work with community organizations that are on the front lines of this issue every day, communities right here, even where there are strict gun laws, are confronting this issue every single day. And it often goes unreported or undiscussed. And I think that's just really important to remember. A lot of times we do this work and people say, why are you doing it in Boston? Is there even a problem here in Boston? And I just think it's really important that we understand deeply that this affects people across this country, even as if Massachusetts were compared to other countries, as David is pointing out, we're still not doing well enough, and that's right here with a lot of the strictest gun laws. And I think that's just a really important framing as we're thinking about what we need to do. It's yes, there are absolutely more gun laws that would make a difference here, But the problem is deeper than that and goes beyond it. And I think that those are really important issues to discuss.
And one of the big things to recognize, too, is that one of the reasons, in terms of total amounts of gun deaths per capita, Massachusetts is typically the best state or the second best state. We always do very well because we have stronger gun laws and we don't have that many guns, though a lot of people are able to have guns. One of our big problems is we would do much, much better, except that our crime guns are largely imported from states around us that have very weak gun laws. So, I know if you live in New York City, like over 90% of the guns used in crime were not initially purchased in New York State, let alone New York City. In Boston, I think something like 2/3 of the guns come from out of state, and the other third come from Western Massachusetts. And so if we were surrounded by other states which had stronger gun laws, we would do much, much better. The same way they are bad neighbors to us, the United States is a terrible neighbor to countries around us. If you ask, how do Canadian criminals get guns? Well, they don't get them nearly as many as the United States criminals can get, but they get them from the United States. How do Mexican cartels get guns? They get them from the United States. And so not only are we hurting ourselves, but we are hurting our neighbors, which is just so horrible.
Hannah, you said you're doing the work in the communities. So in the absence of gun, sort of gun legislation, what does that work look like?
Thanks for asking that question. And I think it raises the point. If we pass different gun laws tomorrow, there are still right now more guns than people in this country. And I think that's part of the reality that we have to contend with. One of the things I focus on, I'm a clinician, a physician. I think a lot about how do we take better care of people who have suffered from this type of violence, both directly as a result of these physical injuries and indirectly, as David was just talking about, that there are downstream effects. We are good in this country, in many of our health systems, at repairing the immediate injuries from a bullet. But what about those hidden wounds? What about the impact on family members? How do we improve our trauma-informed care? How do we center the experiences of people who have been most affected by this trauma? And it can help us better understand what kind of resources, for example, we need to wrap around people who have gone through this, communities that are going through this, and to do this better. So that's a lot of the work that we do, really trying to improve the trauma-informed care, really trying to also think upstream in terms of prevention. How do we recognize people who are potentially at risk and understand how to have culturally competent, relevant conversations with our patients who might be at risk for gun injuries, and improve firearm safety storage, improve people's recognition of other people who might be at risk, and think about creating those conditions that when somebody's in a moment of crisis, we can temporarily get those guns out of that home. Not because of a law says so necessarily, but because we live in a community that looks out for each other, recognizes when people are at risk, and we create the conditions to take care of each other in our community in that way.
This is the first time I've covered a mass shooting. It will not be the last, I say with certainty, and I cannot imagine a more tragic note to end our story than that. Hannah, David, thank you for being with us today.
Thank you for asking us.
For having us.